Okay. Hello. Thank you very much for coming. It's great to see so many of you watching. There really are quite a few of you, which is fantastic. I'd like to welcome all of you to this collaborative webinar on digital marketing for the pharmaceutical sector between the all-knowing Google and digital marketing agency and multiple Google Partner Award winner Fountain Partnership, titled Pharma Marketing's New Age, Digital Strategies to Drive Revenue and Awareness. I'm particularly interested in pharma marketing, having done it myself, so I'm eager to see what's coming up. My name's David Cooper. You can call me Deco. I'm the marketing manager at Fountain Partnership, but it's not me you're here for, because today we've got three highly esteemed speakers for you. Each has immense experience in digital marketing and will be sharing with you insights and strategies to get you thinking about what it is you need to do to increase your revenue. As part of this, of course, will be data directly from Google's immeasurable database, which I'm really excited for. First up will be Rachel, Head of Partnerships at Fountain Partnership, an experienced strategist with a proven track record in both B2B and B2C digital marketing. Then next, we've got Aina, Agency Development Manager at Google, who has been working with Fountain Partnership and supporting our clients for some time now. And last but not least, Liam, International Growth Specialist, also at Google, who is working with Fountain Partnership and I believe only about 19 other agencies in the UK on Google's International Growth Programme. So they'll each be sharing their strategic insights and presentations with you. Then at the end, I'll be dishing out questions you guys watching at home, or maybe even in the office now, submit to them. We'll try and get through as many as possible, so make sure you submit them throughout the presentation. I believe there is a chat function, I believe on that side of the screen. So please submit there and they'll come directly to me. So without further ado, let's not spend any more time on intros. We're here for strategic advice after all. So Rachel, I will pass over to you.
Thank you, David. So good morning, everyone. So as David mentioned, I'm Head of Partnerships at Fountain. So on the webinar today, there is a mix of listeners. I saw seasoned marketeers on the list, but also those pharma brands who are starting to transition to the digital space. I know particularly for you guys, pushing digital adoption is tough. Compliance teams and even pharma marketers themselves have concerns that digital marketing in this space isn't possible. I've heard it multiple times. But the good news is, and why you're here today, it is. And now is a very good time to optimize your digital activity. You all know better than anyone that you now need to be far less reliant on the traditional model of face-to-face rep activity and selling during the current circumstances and beyond. We see the move to digital in your industry as being a permanent requirement rather than just a temporary necessity. You want healthcare professionals, patients, and customers to be consistently aware of you and for them to be able to access the information they need as quickly and easily as possible. And what better way than doing this by being present where everyone's spending a lot of time right now, online. So let's kick off and start with going back to basics. The biggest mistake in marketing is focusing on activities, not outcomes. And the most successful marketing campaigns begin with the end in mind. Now, too often we hear about marketing teams setting shiny new campaigns live without any forecasting about what the results are likely to be. Digital marketing should be a forecasting spreadsheet exercise, taking you away from the traditional Mad Men model to Math Men. Not only does forecasting reduce risk, it also identifies investment levels and upside opportunities. Before setting any campaigns live or whilst reviewing your current campaigns, you need to keep in mind your three most important numbers. What's your cost per acquisition? What are you willing to pay to acquire, say, a new customer if you're an over-the-counter pharma, or perhaps a repeat prescriber if you're targeting healthcare professionals? What are your costs per clicks? Paid platforms will give you an indication of this, and it's also worth looking at your competitor research software, such as, say, SEMrush or SpyFu, to see how aggressively your competitors are bidding. And finally, what's the conversion rate required on site to ensure the campaigns are profitable? This is a percentage of the number of users on site who perform the conversion action you want them to take, whether that be, say, purchasing or perhaps signing up to a webinar. So for example, if the cost per acquisition is £40 and the cost per click is an average of £2, just hypothetical here, then the conversion rate required is 5%. If the numbers aren't working, it's because your CPCs are too high or your CPA is too low. This allows you to see where the problem is in the funnel. Now, once you've set your campaigns live, it's vital that you measure return on investment, no matter what area of Pharma you're in. According to HubSpot's 2020 statistics, only 75% of marketeers are reporting on how their campaigns are directly influencing revenue. Don't be that 25% that wastes their money. This is why at Fountain, we take a full funnel approach to marketing. We track and optimize each stage of the sales and marketing funnel, from initial website interaction through to becoming a brand advocate. The key is in finding out which keywords and ads have led to your highest lifetime value customers and advocates. And doing this allows you to prioritize those revenue drivers with budget and optimization time. Now, in order to do this, you need to ensure that at the outset of any engagement, all goal tracking and attribution is set up correctly so that your marketing data is being recorded reliably and accurately. I know you seasoned marketers, especially in the over-the-counter space, often already have this covered, but you'd be surprised at just how many pharma brands haven't set this up yet. One way to do this is via UTM tracking. A UTM code is a snippet of simple code that you can add to the end of a URL to track performance and campaigns and content. A disadvantage of doing it this way is consistent manual naming, as I'm sure a lot of you know. But if you do this correctly, then you're really going to start to understand which audiences and targeting are generating the highest return on investment. It's really important to track all touch points to fully understand the user journey, not just direct sales. This could be anything from data from retailers who sell your product, data from calls with your sales teams, downloading a white paper, or even say watching a video on the website. Always make sure that you tie these conversion points and data back to your bottom line, bearing in mind the long buying cycle, which is typical for your industry. Okay, so now let's drill down into the advertising regulations surrounding the promotion of medical trial data and products. What strategies should you be implementing and what do you need to avoid? Now, firstly, there is a fantastic opportunity to use a multitude of digital marketing platforms in this space, including LinkedIn, Twitter, Google, YouTube, and Microsoft Ads. Depending on what area of pharma you're in, you can target healthcare professionals and consumers with paid advertising campaigns on these platforms. The aim is to lead these audiences down the funnel to the conversion action that you want them to take, whether that be an online purchase or to raise awareness with healthcare professionals via various micro conversions, with the ultimate aim of them becoming a repeat prescriber. You can create lists, groups, and audiences of HCPs and customers who are keen to learn more about the latest developments in medicine. Now, obviously, we are huge advocates of Google and one of their premier partners, as David mentioned earlier, hence why we're doing a webinar with them today. However, we are channel neutral as an agency, so we want to make sure we cover all platforms with you today. So with this in mind, let's start with LinkedIn. There are a number of ways in which healthcare professionals can be advertised to directly on this platform. However, care must be taken with the language used in adverts, content, and landing pages. You guys are really familiar with this already in your industries. You need to be explicitly clear that this is for HCPs only and not for the public. The regulations for LinkedIn are that ads relating to prescription and over-the-counter drugs are prohibited. The key to success here is keeping your ads and landing pages informational and ensuring that only relevant parties are targeted. So let me give you a few campaign ideas of what we've seen work really well. You can create a group on LinkedIn to encourage HCPs to join and share information and run paid media campaigns encouraging them to join that group. You can also share clinical trial data within these groups. You could also promote webinars, which provide useful information for your audience. I know a lot of you do this already. You can target HCPs and LinkedIn group members and send them straight to a landing page, encouraging them to sign up. Again, take care with the wording on the ads and landing pages, make it informational and not too salesy. Once users have visited the landing page where they sign up for the webinar, they should be added to a remarketing list so they can be targeted for up to 540 days. For this strategy, they should be shown ads encouraging them to read clinical data and other useful information to keep your brand front of mind in a positive way. You can set up remarketing on LinkedIn, Google, Microsoft Ads, YouTube, and Twitter. It's a useful way to build trust with your target audience over time for all areas of pharma. Google Ads and YouTube are also great ways to generate brand awareness and revenue using highly targeted keywords, audiences, and placements. On Google Ads, there are 100 million to 500 million weekly impressions for people interested in the health and medical industry. That's a huge opportunity. The main guidelines for these platforms are that advertisers must be registered with the General Pharmaceutical Council and approved by Medicines and Healthcare Products Regulatory Agency. There should also be no promotion of prescription or specific drugs within ads or landing pages. And finally, where a marketing company such as Fountain might own and manage a domain on behalf of a pharma brand, written proof from the brand is needed to confirm collaboration with the marketing company. Now, the Google team will provide a wealth of exciting strategies and tactics when they speak to you shortly. I'm very excited. But in the meantime, here are a few campaign ideas that we found work really well. Target keywords likely to be used by healthcare professionals. So, for example, those which include medical terminology or publications. If you're an over-the-counter brand, informational keywords work really well. You can provide solutions and information on the ailment that your users are researching. Also, use informational display ads on relevant placements. So, for example, on relevant publications which support the Google Display Network. And finally, let's talk about Twitter. Campaigns on this platform can also be used to raise brand awareness and for encouraging HCPs to sign up for relevant webinars and content, much like LinkedIn. Twitter's ad policy does cover the promotion of clinical trial data, so care must be taken to avoid the use of keywords which make any health claims around, say, diagnosis, prevention, and cures. And as with other platforms, you need to make it really clear who you're targeting in all of your content. Campaign strategies that we've seen work really well are targeting keywords which are used by healthcare professionals, so for example, medical terminology and publications, targeting lists of HCPs to promote brand awareness and relevant content. So this could be, say, an actual uploaded list of contact details or targeting specific Twitter handles. And finally, use both of these strategies to get targeted users to sign up for those webinars or to download content. We've also had quite a few brands, especially in the OTC space, of course, ask us about the pros and cons of using Amazon. We've noticed that a lot of brands are doing Amazon badly, first off. The copy isn't compelling and it just reads like a patient information leaflet. Now, Amazon has typically high conversion rates and it gives you an opportunity to test copy that actually sells, so make sure that you're utilising this feature. You can also get instant traffic through sponsored product ads. But what I say is more important than ever right now is that they have a really reliable distribution network, which is vital in the world we're currently living in. I know a lot of companies, though, don't want to rely too heavily on Amazon. There's a concern as well that there'll be pressure to drive prices down. But I do strongly believe that this channel should be part of the marketing mix, especially at the moment. Now, if you're doing all of these campaigns and some of them are sending traffic to your website, then it's really important that your landing pages and website convert well. Conversion rate optimization and UX are often grossly underfunded, especially in this industry, and this should be a focal point for all pharma brands. Our methodology for this is reviewing user behavior on the website in Google Analytics and other tracking platforms, as well as putting user recording software on the site. Hotjar is easily the best tool for this out of the range available. We use the recording data to see where the users are going, what they're having trouble with, if they're missing key bits of information, and most importantly, why they're not converting or interacting with your brand. From this, we identify quick wins to improve conversion. This could be anything from, say, changing headline copy, form fields, or button colors. We then create longer-term hypotheses, which we recommend testing before implementing, such as changing a form extensively or a large amount of copy. And finally, we A/B split test these hypotheses using software such as Visual Website Optimizer or Google Optimize to increase conversion on an ongoing basis. Here are a few conversion tips for you. It's really important to remember that everyone, especially healthcare professionals, who are less likely to interact with online advertising than consumers, are being bombarded with ads. So it's vital that all ads and landing pages offer value and are easily digestible. We find that interactive audio and visual also works particularly well on landing pages as opposed to reams of copy. You want to serve and not sell at the moment more than ever. Be personal and focus on your customers' needs. You don't have face-to-face interaction as much anymore, so you need to get your customer-focused message across online. So, in summary, Always establish the 3 most important numbers and forecast first to reduce risk. Take a full funnel approach to marketing and track where your most profitable customers are coming from. This is particularly important for those of you with longer buying cycles. Implement smart strategies on LinkedIn, Twitter, Google, YouTube, and Microsoft Ads, but make sure you adhere to the platform's ad regulations to ensure campaign success. Use remarketing on all channels to share useful content and keep front of mind in a positive way. Remember to make the most of those 540 days and change those ads up as regularly as possible. Don't solely rely on Amazon, but incorporate it into the marketing mix. And finally, turn more visitors into customers and advocates by analysing user behaviour and implementing ongoing split testing. Now, I hope that all listeners got something of value out of the points that I've shared today. I'll be happy to answer any questions at the end, and you can contact me later via the details in this slide. Thank you very much.
Wonderful. Thank you very much, Rachel. That was amazing. I think this is going to be a bit of a shameless plug here because I'm also from Fountain Partnership, but this strategy does come from a team that have worked already in the pharma sphere, so have experience in this field, and it is a proven strategy. So thank you very much, Rachel. That's really good. And up next, we've now got the Googlers, the first of which will be Aina, and I'll pass the stage over to you now.
Amazing. Can everyone see? All looking good? Yeah. Perfect. Okay. So hi everyone, my name is Aina, and as David said, I'm an agency development manager at Google. I have the pleasure of working with the Fountain team. I've had it for several months now, and it's been a great experience. And my section is really dedicated to Google Ads specifically. So I suppose firstly I want to go into detail on some pharma trends which have appeared in the US and the UK. I also want to share how you can use some of our Google resources to take action, recognize sudden shifts in consumer behavior, and meet demand when it appears. And I suppose to begin, looking at the period that we've had since the outbreak of COVID and relating it back to Google searches, this is again for the US, there's been a huge peak in mid-March relating to coronavirus searches in the US. And since mid-March to April, we've actually seen quite a decline in COVID-related searches. During the peak COVID period of, say, February to March in the US, while seasonal health categories showed really normal interest, things like colds and flu searches, coronavirus searches definitely surpassed them during that period. I think it's fair to say that during this period of February to March, when it came to matters of health, COVID was really on everyone's radar in the US. And really, what I wanted to do here was to pull some top search query trends. And pulling those, I was able to see how the types of questions being asked online in the US changed from month to month, really as the pandemic progressed. So in January, we had people searching questions around what is coronavirus in the US. In February, we had how many cases are in the US, and really in April, we unfortunately had questions like how many deaths have occurred in the US and when will the coronavirus end. This information gives us, I think, a really great insight into how people turn to the internet for information, but also how their needs changed really as the pandemic progressed. In the US, not only have consumers been turning to Google for information on the pandemic, but they've also been looking for information on symptom and treatment categories and social distancing efforts related to COVID-19. So from the period of January to March 31st, searches for things like Chinese herbal meds were up 57% year on year. Searches for seasonal allergies were up 37% year on year, and immunology searches were up 66% year on year. And these queries actually combined to give a staggering 27% increase in overall health searches year on year in the US. And interestingly, during this time, telemedicine searches have also been on the rise. So telemedicine is a term that I had to Google myself because I wasn't entirely sure what it meant. But for context, for anyone who hasn't heard it before, this would mean the practice of caring for patients remotely or virtually while the provider and patient are not physically present with each other. And really interestingly, in the US alone, searches for telemedicine have increased 338% year on year. So that's a 4x increase in search volume, with particular hotspots around states like New York, Florida, Philadelphia, and New Jersey. So very much on patients' minds. Contrast this with a study that was carried out by LBW in 2019, which showed that virtual care was seen as a much less trustworthy service among patients surveyed. So only 35% felt like they could trust a virtual care versus 84% for primary care in the US. And again, contrast this with 2020 and the results that I just showed you a second ago. We're actually seeing an estimated 28% of visits with healthcare professionals in the US carried out virtually. And that was the source there was a Crossix Solutions survey that was done on the impact of COVID on the pharma industry. And really, in the UK, we've witnessed similar peaks and troughs when it comes to pharmacy-related queries. So in this graph here, you're actually seeing year-on-year growth for pharmacy queries in the UK, so pharmacy searches online. And we can really see two strong peaks during March to April and some smaller peaks since, but all still showing really positive year-on-year growth. So this graph is focused on that year-on-year growth. If we actually compare this to pharmacy queries in Germany and Italy and France, it's really fair to say that the UK has had one of the strongest year-on-year growth trends with sustained growth since then. You can see the likes of Germany having two large peaks, but a much smaller year-on-year growth trajectory. So I suppose you might be asking, what do these stats mean for the pharma industry? And the impact of COVID on the pharma industry when it comes to advertising is really twofold. Firstly, what it means is patients are online more than ever before, and patients of very different demographics. So advertisers and marketing managers really need to be reaching them at every step of the consumer journey online. And secondly, I think what it means is that demand is volatile and difficult to predict. So really, as advertisers, we need to be relying on real-time data trends to be able to meet that demand and understand it. More generally, I wanted to share some insights into how consumer behavior and expectations have changed over the past few months globally. Oh, sorry. So trend number one has been a definite surge in e-commerce. We're seeing the emergence of new e-commerce consumer types. As I said there, the different demographics, especially elderly people, adopting a digital first approach to their searches at an unforeseen pace. And we're actually calling this the silver tech revolution. So I think as advertisers, we need to be asking ourselves, what has this surge in usage of the internet? What does it mean for our consumer types? Is there potentially greater online demand for our product than ever before? Trend number two has seen the emergence of new online habits, and I don't think this will be surprising to really anyone here, but with consumers staying at home more, there's been a rise in demand for things like at-home gear, so technology, home office decor, grocery deliveries, things like that. So as advertisers, again, we should be really asking ourselves, how does our product or service fit in with this new type of at-home demand? And then trend number three, more generally, has shown a shift towards new media consumption. And I don't think this will be surprising either. During the pandemic, consumers really have been discovering new media channels to learn from. And one of those in particular is YouTube, which has seen a really staggering 6.5x increase in news-related UK watch time. And that's been during the period of January to March. So again, we have to ask ourselves as advertisers, how can I make my brand as present as possible across all media channels to reach the right user at the right time? And speaking of YouTube, the last few months have seen a strong increase in telehealth related searches on YouTube. So again, I believe these stats are for the US, but during that period we saw a plus 996% average daily views since March 13th, and over 3,000 hours of video content watched per day since March, all relating to the telehealth vertical. We do need to be asking ourselves as pharmacy companies, are we factoring YouTube into our advertising strategies? Because that's certainly where our consumers are. To give some examples of what people are turning to YouTube for, there were over 110K searches into mental health and addiction supported since March in the US. We had plus 84K searches seeking resources on primary care, and plus 51,000 searches relating to top news on telehealth. And I mentioned understanding online consumer shifts as being vital to successful strategies for advertising. And I really wanted to compile a list of top Google resources for any marketer to help you do this. I start with the most popular one, which is Think with Google. That's our website. And it contains blogs and videos with loads of information on how to deal with the pandemic. And it's really all tailored to specific markets and verticals. So you can see UK specific or US or whatever market you're particularly interested in. I rely heavily on Google Trends, and it really is an extremely useful tool. So you can see top trending queries for different countries, and we just recently actually introduced a section for COVID trends where you can see rising queries actually relating to COVID. A while back when I checked in on this, one of the top queries for the UK was, who is Gemma Collins in isolation with, which was a surprising one, but there you go. You have access to similar insights on YouTube trends where you can see things like trending videos and rising queries across all different types of categories and verticals. Second to last, an important one is Google Ads OptiScore. This is an account optimization score that's visible as a percentage at the top of your Google Ads account. So really it takes into account how well a budget is being used, what keywords are missing, and a host of other things. And most importantly, it shows a list of account level and campaign level recommendations. So always good to be checking in on your OptiScore percentage in the Google Ads interface and the recommendations that are surfacing. And second to last, Google Alerts. It's really a great tool and kind of underutilized at times, but it allows you to set up curated alerts for the topic or competitor, most interestingly, I think, of your choice. And those alerts come into your inbox, and they can come in weekly or daily. And lastly, when it comes to resources, really, it was in response to changing consumer behavior during the COVID-19 pandemic that we decided to launch a rising retail categories tool. And this is available on Think with Google on that blog that I mentioned. This tool helps you to understand fast rising retail specific categories in Google search, the locations where they're growing, the queries associated with them, and the data reflects, I think it updates daily as far as I know to reflect changes in search interest. So it really is a vital tool for anyone with any kind of e-com presence. Okay, moving on then, I want to go into a bit more detail on how you can retain and expand your consumer base to boost return on ad spend. And to begin, really, I think if we're looking to drive loyalty and retain consumers with that high lifetime value for longer, we do need to track and re-engage recent purchasers and website visitors, and really anyone who's shown interest in our product or service. And the main way to do this is through remarketing or RLSA lists. They let you customize your search ad campaigns for people who would have previously visited your site, and then you can tailor your bids and ads to these visitors when they're searching on Google and search partner sites. A caveat to RLSA lists is that is a type of personalized advertising, and I know restricted to some pharma products. So yeah, as Rachel said, it's a case-by-case basis. Another type of targeting we can do is using our customer match lists. So these let you use your online and offline data to reach and re-engage with your consumers across search, shopping, Gmail, YouTube, and display, all the different Google properties. And you can even sometimes might want to layer similar audiences targeting over those, which targets consumers who are similar to those on your customer match list. talking a bit more about expansion and kind of moving away from audience types, I did want to mention an update to our standard text ads. And those are, it's a new product called responsive search ads. So RSAs basically let you create an ad that adapts to show more text and more relevant messages to your customers. So you enter multiple headlines and descriptions when creating a responsive search ad, and then over time, Google Ads will automatically test different combinations and learn which combinations perform best for you. So it really is an extremely powerful product update. Again, on the subject of expansion, dynamic search ads are really the easiest way to find consumers who are searching on Google for precisely what you offer. And this ad type is ideal for advertisers with a well-organized website or a really large inventory of products. So dynamic search ads use your website content to target your ads and can help fill in the gaps of your keyword-based campaigns. Without DSAs, I always say, like, even a well-managed Google Ads account with many, many keywords can miss really relevant searches. So it really helps you to be there at the right time for the right consumer. Another key expansion strategy and an important method of diversifying is the ability to target and deliver to international customers. I know Liam is going to go into this in much more detail in a sec, but the main thing that I wanted to share here was really since the outbreak of COVID, we've not only seen a shift towards more online buying, but also buying from further afield. So advertisers should always be looking to understand market demand really for their products across every single geography and lots of markets. For those who are already exporting, you might find you're getting better ROAS or cheaper CPAs in certain countries, and these would be good markets to grow your footprint in. To add to this point, I've pulled some stats on average order value across different countries, and you might be surprised to learn that the average customer in Germany tends to order products of a value 3 times that of UK consumers. So I thought that was an interesting one. And finally, smart bidding. Most of us already are familiar and have had success with something like eCPC, a kind of semi-automated bid strategy, but fully automated smart bidding strategies like maximize conversions, target CPA, target ROAS, and max conversion value really have the largest impact on advertisers. So if you're looking to leverage Google's machine learning algorithms, if you're looking to leverage all that really good real-time data to convert more and better leads, smart bidding is the answer for you. And that is it.
Wonderful. Thank you very much. Yeah, that was really insightful. It's great to get all this information from you guys, and it's so great that we can actually collaborate on something like this and give this information to everyone watching the webinar. So thank you very much, Aina. And now, finally, Liam's been waiting patiently for his turn. So without further ado, Liam, take it away.
Thank you very much, David. And as David mentioned earlier, my name is Liam Higgins, and I'm an international growth specialist here at Google, working alongside Fountain and a small enough number of other agencies across the UK, helping them to develop their international arm to their agency. I've been working at Google for the past 3 years, and just before that, I actually spent a year in Johnson & Johnson in marketing on their consumer healthcare team. So really feels like I'm completing the full circle now. My plan today is to just take you through a little bit of the export landscape from a UK perspective, take you through some of the most common or key challenges that marketers and businesses experience when they're looking to go international, and also looking at some of the ways that we can look to support businesses through this alongside Fountain and with ourselves as well. Sorry, technical difficulties. So as Aina touched on earlier, the constant that is beginning to present itself since March and the outbreak of COVID is that this surge in e-commerce is going to outlive COVID. And we've seen so many businesses and people adapt to take advantage of this, or even to just catch up with the times over the past couple of months. And as e-commerce surges, so is the growth in international sales, which we can see here are actually expected to reach nearly 630 billion by 2022. So massive, massive growth. But what does that mean then for the broader pharma industry? And what does that piece of the pie look like? So there are actually more than 200 billion global queries for the sector annually. I saw a stat the other day that made numbers like this hit me a little bit differently. Is that 1 million seconds is approximately 11 days, but 1 billion seconds is actually 31 and a half years. So just thinking about that and taking a little bit of a step back, looking at the context of that globally is absolutely massive. So we know that it is huge, but how much of that actually happens in the UK, and what is that opportunity outside of it? So less than 5%. So apart from the very obvious here, what are the benefits for companies who are looking to internationalize, or maybe to diversify what they're already doing in the UK? So companies decide to go global and enter international markets for a variety of reasons. These different objectives at times will, at the time of entry, will produce different strategies, will produce different performance goals. Are you going after more customers? Are you going after customers for cheaper? Or are you just trying to protect your business by opening that new revenue stream? And if we look at some of the key advantages here, we see things like access to more customers, the obvious one, greater sales potential, and reduced cost of acquisition being very, very big. But I think when we look to put that into the context of marketing and what does that look like when we're advertising so successfully in the UK for a prolonged period of time, and then it starts to dip a little bit. So where does this incentive come from for businesses? I hear from customers so often who are looking to scale up their successes in the UK, that they're just trying to squeeze the life out of it, but can't understand the increase in cost of acquiring new customers and the consistently rising CPCs. And although we've achieved brilliant efficiencies and very profitable growth in the UK, we always seem to hit this plateau that we're trying to break through without increasing costs, which for a lot of cases is very, very difficult to do just from a marketing perspective. There are a couple of options that come with that. You could look to move towards a branding approach and look to increase your awareness domestically through the likes of display, through YouTube, through different PR methods as well. Or you could look to replicate that success abroad. So as simple as this looks, this is what it could look like for a lot of businesses and has done in the past, and particularly we're seeing this increasing and accelerating over the last couple of months. But there is a massive fear that is associated with this and looking to maybe move out of the norm, because there is a huge amount of risk associated when we do look at international markets and looking at the potential sunken costs when you do look to invest in your business in order to grow, the same way it is with everything when you are looking to rapidly grow a business. So what are the main hurdles for businesses, and what are the things that we see come up very, very commonly from businesses all abroad? Well, 60% of you seem to think that access to market insights alone is the most important hurdle to overcome. So there's probably plenty of people here who have open access to insights like this, but there's also probably a lot of you who don't know where to start when it comes to things like this. So I'm going to touch on a couple of tools as well later that we have access to that would give us a huge amount of more information when it does come to this. But from an operational perspective, 83% of exporting customers face at least one serious operational issue when they're looking to export. So that execution piece seems to be one of the hardest parts. After we've got those insights and we know which markets we want to go to, the how-to becomes the biggest roadblock. So what operational capacities are required to succeed in markets that we've never worked in before, and how do they vary to our other markets or to our domestic markets? And more importantly, how do we get hold of that information? And this can be a huge cost for businesses to try and bring in consultants or to try and hire people locally or set up an office to gain those local insights. And it will be extremely expensive if they don't get it right the first time around. And to get that right level of insight and advice, we know can be extremely costly. So we wanted to look and break it down and give a little bit of an idea of how we can look to support through that as well. So this is how I would view the process for international growth. For most companies, it involves them determining the new markets and putting in that huge amount of effort themselves into getting the relevant insights and those critical insights to help them decide where to go next. And that's generally where digital agencies then come in to execute the advertising strategy in that second piece after they've done a huge amount of work. Now, Google's international growth partners actually have access to tools, insights, and resources, as well as an ecosystem of partners that are actually able to now help from the beginning of this journey all the way through to the end, and be able to help businesses actually prioritize and understand which markets are most suitable to them based on the business metrics that are most important to that business. So what can they actually look to help you with? So first of all, we look at the market size and the potential. Hello, am I back?
Liam, are you there? Yep, you're back.
Yeah, I'm back. Okay, sorry about that. Wi-Fi obviously failed me there for a second. But to go on to this point, so what can they help you with? What can the likes of Fountain look to actually support businesses on? I think the first point is definitely one of the biggest hurdles that we see. Businesses come in and looking for forecasting and looking to hone in on the total market size and what is the potential on a market by market basis, and being able to tier their entry strategies based on different markets that they want to go after. Who the customers are and their needs, but more importantly, looking in and trying to find different consumer insights in terms of do customers in the US prefer next day delivery, or do they actually prefer free delivery and they're willing to wait a little bit longer? Or what are the logistical issues that actually come with entering into Germany versus France? There's an interesting story about a fintech company who, purely down to the delivery system in France, they have an internal post box and an external post box, that they actually thought that they had a really, really successful launch of their campaign in terms of the amount of signups. But then when they sent out the cards to all of those people who had signed up, they had a really, really low activation level. And that was because the logistics company that they used posted all of those cards into the external post box in France, which actually isn't used at all by a huge amount of French people. They just use the internal ones. So there's so many minor logistical issues. Also being able to look into what's the strengths of the competition and some other barriers to entry in terms of cost, in terms of GDP for particular products, and then what is that route to market as well. So just to start off, one of the primary tools that is now available to Fountain through the International Growth Program is Market Explorer. This is one of our best insights products internally, which is aimed at shaping your international strategy. So it provides market prioritization and market deep dive data using Google internal data combined with some of our partners such as World Bank, StatCounter, and some others as well. So the tool is not only used just to expand into new international markets, but also to analyze the performance of current markets and understand what is the additional headroom to be able to continue to grow, maybe before looking at expanding further into additional markets. So it has insights for every single country for over 1,000 sub-verticals, including healthcare concerns, pharmaceutical manufacturing, pharmacy. So everything from over the counter through to some more of the regulated products. Dependent on your goal as a business, these insights can help you to prioritize markets based on cost efficiencies, based on headroom to scale, and a lot more. And some of these mightn't be necessarily relevant to the pharma industry, but it just highlights some of the business metrics that you can actually look to use to prioritize where is the best country to look to move into next. So the tool automatically will select the top 5 countries based on a default analysis, but you can add or reduce markets that you want to analyze alongside Fountain. So here, the size of the bubble indicates the size of the market we're using, based on Google CPC, based on the overall demand in each of those markets, and then the year-on-year growth in that particular vertical. So for example, this could be in pharmaceuticals. So this allows you to spot some of the outliers or some of those quickly growing markets or those emerging markets that have very, very high potential, but maybe aren't quite the biggest at the time. So a lot of the time you'll see that US is the obvious choice to go to purely based on the volume of demand that's there. But then when we take things into account, such as cost or the level of competition, it actually becomes a lot less viable. So this is really, really brilliant for being able to help us to pinpoint certain markets and go after them with a very tailored strategy. As well as that, it allows us to look into some of the monthly auction metrics and be able to spot those low-hanging fruits, try to see where there's growth in certain markets and certain verticals, and then also be able to identify the peaks and troughs when it comes to seasonality. This is really, really effective for being able to determine what your marketing budget should be across the space of a year, but also be able to identify maybe those early pockets of growth, which some of your competitors aren't necessarily looking at, and be able to go after them a lot more effectively. Just skip that. So just to move back to some of the key operational hurdles that we touched on, that are touched on here. So the biggest challenge that we see across all advertisers when looking to go abroad is when it comes down to localization. There's a funny enough story about Procter P&G when they looked to launch their diapers in Japan, where they used the traditionally Western image of a stork, but then realized that after they launched the campaign that in Japan it's actually a giant floating peach that looks to bring the baby down to parents. So it didn't register. They had to revert back and look to kind of re-strategize. So it is a very, very difficult thing to do, but we have a wealth of insights, and we have some brilliant consultants who can actually look to support you along this process. So some of the other operational hurdles that we see come up is, what do my consumers expect in terms of delivery in Germany versus the UK? What do they expect in terms of delivery prices? What are my competitors doing? How do I balance cost versus speed? Which are all really, really difficult questions to answer most of the time without any expertise or without investing in the likes of consultant or into a third party to be able to help you with. So maybe all you need is a very simple answer here, like what logistics partner should I talk to and what's the cheapest way of doing it. So through this program, alongside Google and alongside our operations consultants, Fountain now also have access to our operations consultants team called the Global Business Solutions team, who have consultants across 4 primary levers, which are localization, logistics, payments, and customer experience. All areas that are absolutely critical to having a seamless customer experience, both locally or domestically, or when you look to enter a new market. So what they can look to do is provide top class advice on market specific insights, provide you with best in class industry examples, and then also look to refer you to some of our best partners in each of those specific markets. So they'll provide those strategic insights, the thought leadership and solutions to help your business to grow and thrive in a global economy. So they are here to work with Fountain and to support them in your marketing efforts by helping you to achieve operational excellence in those global markets, and make sure that everything that you're doing from a marketing perspective is as effective and cost efficient as possible. So just back to this, if you do have an interest in international growth and you don't know where to start, or you don't have access to some of those insights, or you just want to look to scale further and you want to see what the additional headroom is, let us know and we can look to work alongside Fountain and yourselves to prioritize the best new markets for you. That's all from me, but thank you very much for your time, and back to you, David.
Awesome. Brilliant. Thank you very much, Liam. And the program you're running is really cool. So thank you very much for sharing all of that information with us. That's really great. So on to questions now. So there have been a few submitted, and I've also got a few of myself. So first up, Rachel, what software and platforms are best used for forecasting?
For forecasting, was that?
Yes.
David, sorry, you broke up again. So for forecasting, well, we have developed our own in-house tool, actually, that we use for forecasting per channel. It's called our Digital Strategy Builder, and we've created it sort of over the last 3 years. So we actually use our own in-house tool for that, and it can show you, how many sort of sales you can expect to receive, your ROAS, including our management fee. It's all sort of laid out there in black and white. But per platform, there's sort of various ways that you can do forecasting. So, for example, with Google, you can use Google's Keyword Planner, and then all of the information from that then feeds into our Digital Strategy Builder. With LinkedIn, you can use their platform as well. That it will show you sort of, if you input audiences into it that you want to target, it can show you sort of estimated cost per clicks, and again, and also estimated clicks and the audience size as well. So again, that feeds into the Digital Strategy Builder. Twitter is very similar to LinkedIn, and then Microsoft Ads is very similar to Google with their forecasting and the way that's done. So I hope that answers your question. But if you want to talk to me afterwards, then I can run through the tools with you in more detail.
Thank you very much. I hope I don't break up again. Do let me know if I do. But Liam, I've got a question for you here, I believe. And is it possible to download the Market Explorer that you talked about to run against company-owned data so that you can kind of create a model or potential forecast, I guess, as well?
Absolutely. So with Market Explorer now, obviously due to data protection regulations, all of the data is indexed, but you can be very specific in terms of the vertical that you want to compare yourself to. So you can look to specify 5 to 6 markets, say, download the index data, which then allows you to actually start to input some of your own data. For example, if you want to base it off spend and what you're spending in the UK, and you look at the total number of impressions that you've achieved over the last 12 months, what you can look to do is substitute that total number of impressions in for the total index demand in the UK, and then look to index it and benchmark it against some of the other markets to see what is that additional headroom for growth, and what should the budgets be against those as well. So a lot of the time, US comes out as the big one here, and you'll see that it takes a huge amount more of an investment to go into the US. But generally, because there's a much bigger pie to go after. I would also say, to get a little bit of additional information, I'd encourage each of you to use Market Finder, which is an externally available tool, which I should have included in the resources as well. But all you have to do is go in, pop your website URL into it, and it's going to look to prioritize different markets based on market size alone, but has a wealth of information about operations, but also into what the average monthly searches are, what the recommended CPC is by market. And it's a brilliant way to kind of work alongside what Rachel said there from a forecasting perspective. And just to start that initial phase, then maybe bring your ideas to Fountain. They can help you to really nail it down from there.
Brilliant. That's fantastic answer. And final question for Aina. How best should pharma businesses utilize the search data that you provided? Quite a broad question.
In terms of some of the stats that we've seen earlier on, is that it? Yeah, it's a good question. I think in general, when it comes to these kind of trends, it's all about understanding how the consumer is, how it's behaving. And like one of the key trends was that really during COVID, there was no one type of consumer. It was very much a totally new, transformative way that people were looking to use the internet to answer questions or get information. So I think for me, when it comes to data, it's all about understanding like how it's changing, and also what is the latest, or how has consumer behavior changed day on day, week on week, so that we're there to meet demand as it changes. So it's really about using real-time data as much as possible, and then optimizing our campaigns based on that. And one of the key trends that I always go back to is that the consumer journey is much more kind of fragmented now. It's multi-platform, multi-Google property. So we're really not just talking about a search strategy anymore. We're talking about using as many Google properties as possible to meet consumers wherever they are.
Awesome. Well, much appreciated. And that's all we have time for today. So I hope everyone was able to take something away from this. It's been great hosting with Google. Thank you so much for coming. And for those of you that still have questions, please do get in contact with our speakers. I know that Rachel particularly loves to expand her network. So get in contact with her on LinkedIn as well. Do connect. And thank you very much for everyone for coming. It's been incredibly insightful. So thank you to our 3 speakers. And I hope to see everyone shortly. Have a good rest of your days and see you next time. Bye.
Thanks, everyone.